Welcome back to Flashpoint. Our guest this morning, Mecklenburg County Health Director, Dr. Raynard Washington. Now I want to take a step back from COVID itself and some of the sort of side effects that this pandemic has had on people. I know 1 in 5 adults here in the area have reported depression during this time. ER visits related to suicide have increased as well. Talk about that.
Sure. So undoubtedly, as I mentioned just a second ago, we've been dealing with COVID for 2 years, which I think some people might have imagined might have been a 2-week experience or even a 2-month experience, but certainly not this long, as well as the reality that it's here that is fearful, and it makes people anxious. And so I recognize fully that being quarantined or being in isolation or individuals not being able to go and socialize and have contact has been difficult for all of us, not just the community, but even us in leadership and others in the community, those working in healthcare every day. It's tough. It has been really, really tough for a lot of people. And I fully acknowledge that. And for some, that toughness has transitioned into really the need for mental health support or care or services. And we have seen an uptick in the demand for those services. And I've heard both anecdotally and also data shows that people are experiencing more distress or depression during this time because of the isolation, as well as and the lack of engaging in regular activities that help keep us encouraged and motivated. And so we know that that's important. The county quickly mobilized the Meck Hope Initiative to make those treatment and support resources available to those in our community who may not have health insurance as quickly as possible. We are looking at a number of ways right now to expand those resources even further, make them permanent, so that we are able to support individuals who are experiencing mental health conditions, whether they be low acuity or high acuity, that they can get the support and care they need and deserve.
All right, I want to talk about something that's perhaps the most taboo of all topics, and I don't know that we've ever devoted a segment to it on Flashpoint, and certainly on local TV, it's not something we ever talk about on a regular basis, and that is sexually transmitted infections. And this is a big deal because over the last few years, a lot of it during the pandemic, Hep A big spike going back the last several years after seeing hardly anything for the last 15 years. Chlamydia, the most common thing here in the Charlotte area. Gonorrhea cases at a high rate as well. Syphilis as well, increased 45% in the last 10 years. A reported increase in HIV diagnosis, even though there's been a 60% reduction in actual testing. What is your message to the folks out there? A lot of this disproportionately affecting younger folks, communities of color as well. As health director, what are you going to do to combat this as we come out of this pandemic?
Certainly. So as you know, as you've already mentioned, these issues relative to STIs have been increasing, not just here in Mecklenburg, but across the state and country for the last decade. And it is certainly concerning. And I believe that our teams, I am so fortunate, have been continuing to work even throughout the pandemic to continue our full-scale prevention, intervention, and treatment for all of those conditions. And we will be working, as you know, in Mecklenburg County, we've been fortunate to receive additional support and funding from our federal partners as a part of the ending the HIV epidemic. And so we are looking very strategically at our work. I talked a lot during the board meeting last week about a number of the initiatives that we've put into place, particularly on the prevention side, our PrEP program, our work to make sure we expand access to testing, as well as access to contraception.
To that point, let me interrupt you just real quick, because some people might not know what you're talking about. PrEP, and the generic name, that's the generic name, that's Truvada, that's Descovy.
Yeah, so PrEP is a pharmaceutical, as an oral medication that individuals can take, particularly individuals who are at risk of HIV infection can take on a daily basis to basically protect them from developing an HIV infection if they're exposed. So it's a once-a-day pill, and the county provides support and clinical care to individuals through a number of our community partners to help support them as they're taking that medication.
Really important information that some people might not know, and I'm glad that we can sit here and talk about it in an honest, frank way. Dr. Raynard Washington. Doc, thanks for coming on. We appreciate it. We know you've got your hands full right now.
Thanks. I appreciate it.
All right, take care. More Flashpoint after this.